Hello, everyone. Good afternoon, and I am pleased to be here today with a number of partners who I'll be briefly introducing to make a major announcement with regards to childcare and the assistance that Erie County will provide through the CARES Act through 3 initiatives as part of our work that was done by the Emergency Child Care Task Force that we impaneled earlier this year. You will hear from, right after I speak, Deputy County Executive Maria White, who will go through the parameters of the initiative. You'll also hear from Legislator Lisa Shamara, who's a key partner in the task force. From the Buffalo Public School District, we also have Will Carestis, who can talk a little bit about how this will impact schools. We're also joined by Jacqueline Hall from the Department of Social Services. The Department of Social Services was key in setting up this important initiative, which is actually 3 initiatives, which Deputy County Executive White will talk in just a moment. But first, I do want to note is that we have 3 initiatives with a total amount of money that is available of $25 million. An initiative that will assist parents, an initiative that will assist child care centers, and an initiative that we can work with our local school districts to set up special distance learning centers where there may not be child care available otherwise, but parents still need it. And these are 3 important initiatives that we believe will make a big difference in our greater community. Before I go forward, I do want to thank Karen Gambino from Deaf Access Services for being here today, providing the American Sign Language. And with that, I'm going to turn it over to our Deputy County Executive Maria White, who has spent a lot of time and effort with regards to this proposal. I thank her for the work that she's done earlier this year in helping to set up the Emergency Child Care Task Force, but then working with the task force on these initiatives. This was not something that was put together overnight. This took many weeks. I want to thank the members of the task force for the work that they did. They could not be here today primarily because of the size of this room and the limitations associated with COVID-19. And I also want to give a good shout out to our Commissioner of the Department of Social Services, Marie Cannon, who put a lot of time and effort. Marie is actually off this week, well-deserved vacation, but I did want to thank Marie for the great work that she did, and on behalf of her team, thank them as well. So Jackie, thank you for the great work of the staff of the Department of Social Services. And with that, I'm going to turn over the podium to Deputy County Executive Maria White to talk about the specifics of these 3 major initiatives. Deputy County Executive.
Thank you, County Executive. Thank you very much. I want to just pause briefly and recognize the leadership of our county executive. I think one of the best definitions of leadership is the capacity to translate vision into reality. And the county executive has understood from the very beginning of the pandemic that childcare has been a really essential issue. The Emergency Child Care Task Force was the very first task force that he created back in March of 2020, putting myself and Commissioner Cannon as co-chairs of that task force. And it was really his vision to use CARES Act funding to help address the challenge that we presently find ourselves facing. And he empowered myself and the commissioner, as well as members of the task force, to turn that vision into reality. So it is my great pleasure today to help announce exactly how. As the county executive mentioned, DSS Commissioner Marie Cannon and I co-chair the task force, and we have been working with BOCES 1 and BOCES 2, as well as the school districts throughout the pandemic. And when the school districts announced their virtual models just earlier in August, we knew there would be a problem for working parents, in large part because, unlike in March, when the economy was closed, parents now are expected to physically report to work. So the first thing we had to do was really uncover how big is the problem. And we did that actually by conducting a survey. So I'll just try to advance the slide there. So we worked with Erie 1 and Erie 2 BOCES to survey parents. BOCES reported to us that over 7,000 parent responses were received. And from that survey, we learned how many of them are facing tough decisions on how to juggle family and school responsibilities. Meanwhile, we also worked with the Childcare Resource Network to survey childcare providers and to learn how many of them could assist school-aged children during the school day in a virtual learning model. And what we learned from these two surveys essentially is that the existing capacity in the childcare system is nowhere near sufficient to meet the needs of the parents struggling with their children's virtual return to school. And so we developed a plan to use the Coronavirus Relief Act funding to help alleviate this burden for parents and families. And here is how the funding will be allocated. So up to $4 million in CARES Act funding will be used for the direct support of childcare providers to sustain them now, really, after the significant financial hardship so many of them faced when enrollment was down in the spring. Additionally, we will be investing up to $10 million to replenish and expand the child care subsidy for school-age children to include families earning up to 85% of the New York State median income. And finally, up to $11 million in funding will be allocated for the creation of new virtual learning support centers, countywide. And that will be done in close partnership with Erie 1 and Erie 2 BOCES, as well as with the school districts across Erie County. And as the county executive said today, we are represented here by our biggest school district in the Buffalo Public Schools. So this multi-pronged approach really addresses the areas of need for parents and for educators, and it uses available funding to help bridge gaps and facilitate new ideas. Child care providers that are hit hardest by the losses and programmatic changes they experienced early in the pandemic will receive direct financial support to bring them back and make sure they are fully operational to help with this upcoming challenge. Then more families, many of whom send their children to public school and don't have any room in their budget to pay for child care, will receive financial support they need with an expansion of the child care subsidy to include families earning up to 85% of the New York State median income. And this graph tells you a little bit about how much you can earn and still qualify for the child care subsidy here in Erie County. We know this will ease their burden and give them some breathing room. And then in its first of its kind collaboration, we are partnering with the school districts and with BOCES to create these virtual learning support centers countywide. These centers will provide safe educational spaces for children when they are not in their school setting but still need to continue their education in a supervised environment. And also so exciting, Erie County's GIS division. We often underappreciate the role GIS services can play in helping to support our work. And the GIS division has provided a map to help school districts identify potential spaces to establish virtual learning centers and give working parents and caregivers the room that they need to ensure their child's education is properly continuing. A lot of work remains to be done in this program. However, doing nothing and leaving vulnerable children at home alone in charge of their own education, and in some case in charge of their younger siblings' education, while working parents try to provide for their families, was simply not an option. Funds for the virtual learning support centers will be made available through a grant process that begins immediately. The grant application is live on the county's website today, right now, and applications will be due in very short order on Monday, September the 14th, with funding awards announced just a week later on Monday the 21st, and with the expectation that some programs, at least some programs, will be operational by Monday, October the 5th. Funding will be available through December 30th when the CARES Act funding expires. Really, I just want to close by saying that public education is a pillar of our democracy, and it is part of the American social contract. And that contract is really as old as the country itself. And this is why I really want to thank the county executive again, because this funding presents all of us with an opportunity to uphold that social contract between families and schools in our communities. And most importantly, because it presents us with an opportunity to meaningfully meaningfully support our young people in their education, a promise that was made to them and which must be kept even in a COVID-19 economy. And I think with that, I would very much like to introduce Legislator Lisa Chimera. Legislator Chimera is an active member of the Erie County Emergency Child Care Task Force. She is also a middle school educator in the Kenton School District, and of course, a parent as well. We are so grateful to have the legislator's leadership here, and we invite her now to the podium. Thank you.
Thank you, and it is a pleasure to be here today. As an Erie County legislator, I had the honor of participating in the Emergency Child Care Task Force. I was so proud to work with such dedicated stakeholders, and this group accomplished so much in such a short time. I applaud the Deputy County Executive, Maria White, for her extraordinary leadership. It was really a huge undertaking. But today I'm not here to speak as a legislator only, but as a working mother and as an educator. I can understand the stress that this pandemic has placed on all of us, especially our families, and most importantly, our children. Parents have struggled with the reality of providing financial stability for their family while also supporting their children through this remote learning process. Just yesterday, a parent of a 6th grader called me in tears. I have to make a decision. Do I quit my job and stay home to support my child in remote learning? Or do I continue to work and provide for my family? No parent should have to make that decision. As an educator, I experienced the difficulty of teaching without having my students in our classroom. I worried about them every day and spent countless hours not only on their academics, but also concerned about their emotional well-being. We are now beginning a new school year that will continue to bring great challenges that this pandemic has created. Our first priority must be to keep our children safe. Thank you to our wonderful county executive for his leadership throughout this entire pandemic, and most importantly, with this announcement of the $25 million. This $25 million will continue to fund childcare subsidies, childcare facilities, and now for these virtual learning centers that will be a great resource to our children. This money is greatly needed. We know that every single community across Erie County will have different needs, from internet connectivity to teacher training, but everyone's goal here is to support our working families and our children. But we cannot stop here. We must continue to pressure our federal government to support municipalities and school districts so that we can keep providing this much needed relief that our families deserve and our children are counting on. So thank you again.
Thank you so much, Legislator. It's my great pleasure to introduce Dr. Will Carestis. Dr. Carestis serves as the Chief of Intergovernmental Affairs for Buffalo Public Schools, right? And we'd welcome him to the podium now. Thank you.
Thank you, Maria. I'm only going to have a few words, really, of commendation. County Executive Poloncarz, you, from the beginning of this COVID closure, you have been a champion for schools, public districts, private schools, all of the children in Erie County, and you have provided reliable and strong leadership that we have found really essential to our planning for this reopening. But it goes without saying that For this particular initiative, we have been guided by the strong and notable leadership of the Deputy County Executive, Maria White. It's been notable because getting everyone together on the same page to make decisions is a tough job in normal circumstances. And to be able to do it in the midst of a pandemic, when everyone is really trying to figure out how we're going to safely reopen schools, was a tall task. You were up to it, and you did an outstanding job. This opportunity is going to allow us and our partners to take to scale the type of educational environment that students are going to need while they're learning virtually. We hope that that won't be for a prolonged period of time, but while it's going on, we know that families are going to need support. And we would not be in this position were it not for the decisive and really consistent leadership that has come from Erie County throughout this entire pandemic. So on behalf of Superintendent Cash and our Board of Education, and I know I can speak for school districts across Erie County, we want to thank you for everything that you've done to really champion the support that our families are going to need. Thank you.
Thank you, Dr. Crestis. Thank you, Legislator Shamira, for also putting the real reason why we're doing this, and reminding people that this comes down to educating and protecting the children. This is not an easy endeavor. We know it's going to take a lot of effort to just get through the application process and provide the grants, and that's why I want to thank all the partners who played a role in this. Specifically our Department of Social Services, once again, Jacqueline Hall and her team, under Commissioner Cannon, who've worked very hard to come up with what we believe is a very, very viable, workable plan to address the child care needs in our community. As you said, the opportunity to apply for the school district and designee grants is actually effective now. Same thing with regards to the issues associated with child care centers. For parents who may be questioning whether they qualify for the subsidy, it's actually much larger than most people think. You can actually be making a sizable amount of money depending on how many people you have in your family and qualify for child care assistance. We have the information on the board. As you say, it says 85% of the state median income compared to the 200% poverty level, but the thing to look at is the third column with the dollars. So you could have a family of 4 and still make up to a little over $100,000 and qualify for child care assistance. So we want a lot of individuals who may not have previously applied for child care assistance but may have qualified for it to apply. We want every family out there to know that it exists. You can apply for this assistance, and Erie County will provide it and pay for some of your child care needs, which we know there's a lot of needs out there. So with that, I'll open it up to questions from the media on this topic and then any other COVID-19 related topic that may exist. Erica?
Do all 3 facets of this initiative have to apply? Do parents apply through Erie County's website? Do the school districts apply? And do child care providers apply?
The question was, do all 3 have to apply, and is there an application process specifically for all 3? And the answer is yes. We are providing assistance based on the plans that will be provided with regards to the virtual learning centers. The child care centers themselves would qualify as long as they're an active child care center and they're providing the service currently, and then they get a certain amount based on the size of their population and the amount of students that they provide. For parents, you have to apply through our Department of Social Services, through the normal, what would be the child care subsidy program. I'm actually going to ask Jacqueline Hall from the Department of Social Services. She's rolling her eyes like, oh, I thought I was not going to have to say anything, but I'd ask her to come up because she's the expert on the process and how the system goes. So this is Jacqueline Hall from her Department of Social Services.
Thank you, County Executive. So to answer your question, in terms of how to apply for each one of these funding buckets, for the virtual learning centers, that application process, again, is on our purchasing website, and that is to be applied for through school districts or the school district's designee. For parents who are eligible for the up to 85% state median income, they would have to be eligible and again apply through our low-income subsidy child care program. That is also on the DSS website for them to obtain the application or the contact information for them to have an application mailed to them. In regards to the the child care centers, that will be based on a scaling fee of the number of subsidy youth who are actively enrolled in that child care center, and there will be an application that will be administered through a partner of ours.
Not through purchasing like the virtual center?
Not through purchasing. That will be open through an application process. Once we actually can announce who our management administrator will be, we will then have a press release announcing what that process will be.
Thank you. Follow-up question, if that's okay?
Why don't we go, Michael, and then come back to you?
For child care providers, I've been talking to one provider in the area, and they said that this is a good start, but they're wondering who's going to be getting priority for the funding. Is it first come, first serve when it comes to these applications?
We've set aside enough money, we believe, to cover the child care providers. So it's not first come, first serve. If they apply, they should qualify based on what we know as the number of children that they have that are under the subsidy program. So it is not, if we had applications from 100 organizations, we could only pay for 50. We've set aside enough money in that bucket, so to speak, the $10 million to cover the child care providers that we are aware of and are participating already in the program. It's possible there could be a child care provider out there we don't work with that has not been participating in the subsidy program. But based on my knowledge, they pretty much all are, right? Mm-hmm. Yeah.
Is it just for PPE?
No.
Payroll?
This is to assist them to provide childcare for our community. It's not just, it's not like what we did with the school districts or the municipalities in which we provided them a certain amount for PPE purchase, for distance learning. This is to provide assistance to them so that they can operate as a child care center. What we need now are these child care centers to open. We can't have them closed. We don't need them shutting down, because then we have less opportunity for children to actually take part in child care. So this is basically for any cost associated with running the operation, which under the CARES Act we can do, because this is sort of above and beyond what was normal expectations due to the issues associated with COVID-19. You want to follow up on?
Yeah, so that kind of answered my question. The $10 million subsidy is for parents to apply for. The $4
Yes.
million is direct to daycares, right?
Yes.
Is $4 million enough?
The question was, the $10 million subsidy was for parents, the $4 million is child care providers, and the answer is, I think I may have messed it up a little bit when I was responding. But the answer is yes. We've determined based on the number of providers that we have and the dollar figure, because as I think the Deputy County Executive wants to say, we came up to a certain amount that was to be provided based on the information we received from the child care centers themselves. It's not that we just picked a number out of the air. We received a number as to what they thought they would need to assist them in this process, and we used that. So, Deputy County Executive?
Yes, thank you, County Executive. You're precisely right. That $4 million bucket is expected to cover approximately what will be necessary. Once we have the details on that, I suspect it will be around that range, but we base this formula on the advocacy of the child care providers themselves. So they conducted a press conference just last week. Assemblywoman Monica Wallace was active in that press conference, and the statewide network of child care providers created a formula based on the type of provider that you are, as well as the number of children served in your particular child care center. So, for example, family child care centers would receive something like $3,500 as part of this. Group family child care centers might receive $5,500. Center-based programs that have less than 100 children would receive $5,500, but if they had more than 100 children, they might receive $7,500. It's a formula based on what the advocates put together, and we adjusted it in part, as Jackie indicated, based on the number of children who currently attend that center and receive child care subsidy dollars. Why did we do that? Because we understand that centers that take the child care subsidy from Erie County receive a lower amount than what you might privately pay, for example, at any other child care center, and we understood that they would have some additional unique challenges there. So we anticipate that that bucket is enough or is very nearly enough, and the intention here is to help the providers that are registered with our Erie County Department of Social Services.
Question?
This virtual learning support center, exactly how is this going to work with actually getting these children to be?
The question was the virtual learning support centers, how is it going to work? And that is actually in some ways being left to the organizations to propose how they're going to do it. It could be housed in a school. It could be housed in a library. It could be housed in a community center. It's going to have to be staffed by individuals that are approved to provide that service. We know that the New York State Office of Child and Family Services, which normally approves these organizations like child care centers, is giving us the opportunity to implement these in countywide, because they understand that this is something that cannot wait. Normally the process to get approved as a child care center can be long. This one is going to happen very quickly because it's going to be partnering with the institutions, the school districts themselves or their designee, which already have some child care responsibilities, not only with regards to the education of the students, but times in which they're at the schools when they're not being educated. So it's going to vary. One area, they may be going to a library. Another one, they may be going to a community center. For another, they actually may be going into the school. Depends on the application that we receive. So there's no one size fits all. And I think that's important. We leave it up to those in the community that are going to be providing the service through these virtual learning centers to come up with a solution that works for them. Now, if we get something that we don't think is appropriate, we will go back to them and say, we have problems with this. This won't work. This is not the appropriate site. Putting it in the neighborhood bar is not going to be appropriate. So not everything's going to work. But we have to take a look at the applications that come in. And we're hopeful that the applications utilize the services that already exist, the facilities that already exist, which makes it a lot easier to move ahead with the process as compared to saying, well, we want to completely reinvent the wheel and here's how we plan on doing it. That might work, but it's going to be based on what the application says and what we think is appropriate and what also the state would authorize too.
So there's not necessarily a scenario where the kids would be physically in there or with these virtual.
Oh yeah, they will be. That's the goal. The goal is to provide a location where the parents are at work, where the students are somewhere other than home. There will be individuals there supervising them. There will be individuals there helping them, making certain that they're taking their virtual classes, assisting them. So this is not like it's going to happen in somebody's house. It's going to happen in a location, and it could be a school, could be a community center, it could be a library, could be another location, senior center, where there will be individuals who will be acting as if it's a child care center, but also ensuring that they're not just sitting there and playing when they should be taking their virtual classes. So it's pretty complicated. I know some parents are like, well, why would you put them in that situation if they're not going to schools anyway? Well, for a lot of parents, they have no choice. They have to put their child somewhere because they might lose their job. There's a story, as Legislator Shamara noted, the 6th grade mother who said, I may have to quit my job. That person needs child care. And this is a situation where we can put them in an environment where not only will they be receiving the virtual learning that they should be getting, whether it's at home or somewhere else, but that there's someone there to ensure the child is actually doing the virtual learning, following up on the assignments and the like. So it's an expanded child care center for those who normally wouldn't get child care because they're in school. So most parents might be used to having child care between birth to kindergarten and then maybe a little bit afterwards. But once the child's in school, usually that's the child care during the day while the parent's working. They're in school. But we know because of situations where it's 100% virtual, like the city has gone to, or West Seneca or others, or partial virtual, there are days in which the children will not be in a school setting, but they need to have learning. They need to ensure that someone is watching over them so that they are following their lessons from their teacher. They are following up on the assignments. And that's what the virtual learning center is. When we say virtual learning, it is an actual place where the children will go. And the virtual learning will come from the computers, from the teacher, but they will be there watching it, and someone will be there overseeing, making certain that the children are following up on their assignments and actually paying attention to Ms. Chimera when she's giving her lesson.
Mark, we learned through this process that transportation to schools is proving to be a monumental task to try to take care of. These virtual learning support centers, how are the kids expected to get to school if, mom and dad are both working?
The questions with regards to transportation, how are children going to get to these virtual learning centers, and that's all part of probably the response that we'll be expecting from some of the virtual learning centers. I'll leave it up to Deputy County Executive to talk a little bit more, because I know this is something that they did talk about when they formulated this plan.
Thank you, County Executive. Of course, transportation definitely has been identified as a challenge. It is our objective to help make sure that there are centers all throughout the community such that transportation to the virtual learning center can either be handled by the student walking there, perhaps by being dropped off there by private vehicle, possibly by public transportation. I mean, it is the case in some school districts that they are not presently providing transportation. So transportation definitely is a challenge, and we have asked in the application process for each of the districts to reflect on how they will help address that challenge. And in some cases, it may mean just having so many sites throughout the community. I suspect in the city of Buffalo, we will have dozens of locations in order to help do that. And frankly, Mike, this was part of why we had to undertake this process in cooperation with the school district. We considered an application that would simply go directly to childcare providers and invite them to apply to establish these virtual learning centers. But in the end, we decided that it needed to be in cooperation with the school districts. Why? Partly because of transportation, partly because of food, feeding the children, also partly because the school district is the one that establishes the online learning platform that will be used by the student. And we know that there are a half a dozen different platforms. I mean, my son and daughter both go to school in the city of Buffalo, and they are using different platforms themselves, partly because of their age and grade. So we wanted to make sure that training of the staff for running the virtual learning centers would be in coordination with the school district, such that the individuals running the centers properly knew the online learning platform that was going to be used by those students.
So just so I know I understood you right, are school buses at Buffalo schools being used to transport students? Because you mentioned public transportation or walking. I mean, a 6 or 7-year-old walking, that's obviously not something.
Sure, no. I think Buffalo Public Schools is not using transportation during the time period when they are virtual. Was that your question? So Buffalo Public Schools is virtual until the first marking period in October. So at least in Buffalo Public Schools, there is not public transportation during that time period.
Okay, so I guess I'm still confused how, a 6 or a 7-year-old would get to these learning centers if their parents aren't working. You you don't want a 7-year-old riding an NFTA bus. I think most people can agree on that. I guess I'm still confused about how these kids would physically get to the learning center.
Yes, this is why we have invited the districts to help answer that question as part of the grant application. And we've considered that as an issue and have recognized the need to establish centers all over the place, in part because of that reality. Why put $11 million into this particular bucket of funding? In part because we know we would need multiple centers to help make them convenient for parents and families. I think another issue we have to consider is that we want to make sure that the children are properly social distanced, right? So we have to keep those ratios small of the virtual learning instructor, so to speak, to the children. And that means we're going to need lots of spaces in order to do that. The county executive talked about some of those spaces, but church fellowship halls, community centers, libraries, all are options.
I think the thing to remember is that this is, once again, there's no one-size-fits-all.
Right.
What works, it may work in the city of Buffalo, may not work in the town of Collins, where they're in the Gowanda School District. So, and you may get into the bus during the day, and you might be one school where the child goes to for primary for all of the the citizens of the Gowanda School District. So I think it's important that people understand that we're going to get responses back from the school districts, which are going to vary. And we'll be considering the responses as a result of that. Are there any other questions on this topic? If there's any other questions on COVID-19?
I did have one more question on this topic. Should child care centers that have been struggling throughout this pandemic, and they voiced their concerns multiple times, should they be viewing this as money that would come to them that could save them? Or is this just something that they should view contextually as, this is just a little bit of a boost just to help a little?
Well, the question was, should child care centers that have been struggling consider this money to save them or just a boost? I mean, it's both. It's going to provide them additional assistance. Hopefully, there'll be more people who will be taking advantage of child care now that there's additional money that's available based on the subsidy level. Some child care centers have been very busy throughout the whole crisis. Others shut down. So our goal is to ensure we have enough child care for the students and children in our community across the whole county. And that requires assistance from the child care centers staying open, from virtual learning centers that are being created, because we know based on the need, we do not have enough child care slots as it is today. So we have to do something in addition. And if we lose a child care center, then it makes it even tougher because that's less potential opportunity for a child to be in a location that's safe and that can provide them the educational assistance they need while they're virtually learning. Question?
Question on behalf of Ally Toon. She was wondering if you support the allocation of $22 million in CARES Act funding for struggling small businesses that are here in Erie County?
We have already put in place a number of programs for small businesses, including a grant program that exists through the Erie County Industrial Development Agency. I have not seen anything specific with what the legislator proposed. We are always considering things, but there are certain restrictions that have to be in place. You just can't give money and say, here you go, spend it any way you want. Child care is different because of the needs, and it's specifically noted in the CARES Act as you can provide assistance. Small business is different. That was covered under the PPP program. We do provide grants through the Erie County Industrial Development Agency, up to $10,000 for small businesses for PPE and other types of products that they need to protect their employees and their patrons and the like. It's sad to say that we've only had a handful actually apply for it at this point. It's actually kind of surprising. We thought we'd have many more apply for the assistance, and that has not happened at this point. So we'll consider everything, but we already have a number of programs that exist to provide assistance to our local business community above and beyond the PPP program, which has existed. And it's my understanding Congress is probably going to do something by the end of September to provide additional assistance for small businesses. But we'll consider everything. I just haven't seen that proposal. Anything, Erica?
The governor's comments this morning were a little bit bleak. You tweeted your own warning and concern. Your thoughts on where Erie County's infection rate is right now, as well as it pertains to Erie County's universities and colleges?
The question was in regards to the governor's comments today with regards to the higher number that we see in Western New York. Following up on my comment yesterday, which is if we do not keep this down, I would not be surprised if the state potentially shut down some businesses that they've allowed to reopen. I'm not the amazing Kreskin. It's not like I just pulled it out of thin air. I know the thoughts of what the state's doing. I know their concern. I know the governor's concern. It's a legitimate issue. We have the highest contraction rates of COVID-19, the coronavirus, in all of New York State. For a while there, we had the lowest. And it's not just Erie County. It's happened in other communities as well. Chautauqua County, Niagara County have seen an increase in cases. It is not just college students, though college students are a portion of the new cases. We're seeing family clusters. We're seeing small clusters associated with a business where there may be 2 or 3 individuals in a business. So we test others. We test them. We're testing college students. We're testing people associated with nursing homes. We're testing people associated with healthcare organizations. And that's why I want people to understand it is general community spread. We have it in our hands to control it. Wear the mask. Try to practice safe social distancing so you don't have to wear the mask. If you're out in public, you should wear the mask if you're around people that you haven't been around. I give the best example of why this is a reality is what happened in Pittsburgh and Allegheny County. And I know you weren't at my press conference yesterday, but if you saw the slide, we showed that Allegheny County, which for the longest time had substantially less cases than what Erie County had, now has more cases. And when they saw this dramatic rise, what happened in Pittsburgh and Allegheny County, and then was done statewide in Pennsylvania, they reclosed their bars, they shut down the indoor dining in the restaurants, they did other things, shutting down other businesses that had reopened after being closed. And they did it because they were seeing this big spike. It worked. It helped reduce their cases. I don't want to see that here. That would be devastating to a lot of businesses that are hanging on the edge. But people think I'm saying it's a joke, and they're yelling at me like I've seen it on social media, like, oh, polling cars, you just want to shut us down. I don't want to shut us down. That's hurting revenue that would come into Erie County, and we're facing a substantial budget shortfall for next year, a very large one. And so I don't want to see these businesses get shut down. I want to see us safely open so that we could open even more, or that maybe restaurants, instead of being at 50% capacity, could go up to 60% capacity and 75% capacity. That's what I want to see. But New York is not going to allow that if our numbers keep going up. And people who say it's just college students, it's not just college students. College students are being tested and are being tested positive. But seniors are being tested positive. Children are being tested positive. Regular average age adults are being tested positive. People who received their letter from AARP because they turned 50 not too long ago are, well, I'm not positive, but people my age are positive. Don't want people to think I would tested positive, because I've not tested positive, and I have tested in the past.
Turned 50.
I'm well past 50 by now. But I want people to understand is every age range can get sick. Every age range is testing positive. And so for those who are pointing the finger saying, oh, we shouldn't allow colleges to reopen, that's not my call. We have a lot of colleges in Erie County. It's just part of the overall numbers which show they're going up. And it's not just us. Chautauqua County's going up. Niagara County's gone up. Even Cattaraugus County's had more cases recently. That happens because people are not taking it seriously. They're not wearing their masks. They're not safely socially distanced. We get reports every day of people who refuse to wear masks but want to go into a retail establishment. The retail establishment has the sign, no mask. It's the same thing as like no shirt, no shoes, no service. They should treat it the same way. You do not get the right to put other people at risk just because you don't want to wear a mask. And I do know, because we've gotten those cases from our contact tracers of individuals who are like, I'm never wearing a mask, and then they tested positive because they got sick. And we've had the reports of people like, I thought it was a hoax. Then I got sick, and I got really sick. Thankfully, those people lived. But they wear masks now, and I hope that they keep on pushing that message out, because it is unfortunate and completely unnecessary if we get shut down again because our numbers are continuing to go up. And you know what it'll hurt too is the school districts that have agreed to reopen in person. And that'll make all of our lives even tougher because they still have to provide virtual learning. But as the numbers show, if we get to a certain percentage, New York State will shut down all school districts in those regions from in-person learning. We're not anywhere near that point yet, but we are the highest in New York State, and it is unacceptable in my eyes. Any other questions?
It's just kind of merging those two together, those two questions together, going forward, looking at the next couple months, what can you tell us about your thoughts on the small business relief proposal, just in relation to...
Well, the number one thing that I'm working on right now is the continued getting what would be considered the HEROES Act passed in Washington. The House of Representatives passed the HEROES Act, which is a $3 trillion assistance program, including providing substantial assistance for businesses, large and small. The Senate has not passed anything, and that's unconscionable. The U.S. Senate has not passed anything. And the HEROES Act has a proposal in place that's a good proposal. There's been some discussions with regards to finding a middle ground, maybe a $2 trillion program, which also assists our small businesses. We need that. We need our federal government to act. We need an extension of the PPP program. And that's the best way to do it, is for the federal government dollars to come in. We if it doesn't happen, we're going to do what we think is appropriate to assist our community, all of our community. Our CARES Act funding has to get spent by the end of this year, and trust me, we're spending a lot of money. We're spending a lot of money. And our goal is to ensure that we spend all of our CARES Act funding for the appropriate purposes, but the best way to assist small businesses is for the federal government to pass a program that extends the PPP program, the Paycheck Protection Program, and also provides assistance to local governments to address the problems that we face, such as tens of millions of dollars of budget shortfalls, that then force us to cut programs. If I had not received CARES Act funding, we would not be here today, because I do not have $25 million to put into childcare, just like I didn't have $15 million to put in school districts, or what potentially would be $5 to $10 million for local governments. It's because of the CARES Act funding. We need another round, a CARES Act 2. I don't care if it's called the HEROES Act or what the Senate proposal was, the HEALS Act, which hasn't been voted on. CARES Act 2. It's fine with me. I don't care what it's called. Just get a proposal done that helps us locally, not just in Erie County, but across the entire United States. Thanks, everyone. Be safe and well. Wear your masks. Go Blue Jays. They're playing well. They keep it going. I think they're going to make the playoffs. So the only time we have a Major League Baseball team and they make the playoffs. Okay, let's do it.